Doppler ultrasound in antepartum fetal surveillance. Doppler ultrasound of the umbilical artery especially is used to assess the blood flow to the fetus via the umbilical artery. In this, the systolic is to diastolic ratio is most commonly used, and it is considered to be abnormal when it is more than the 95th percentile for the corresponding gestational age, or if the diastolic flow is either absent or reversed. In these conditions, the Doppler ultrasound is said to be abnormal. And the perinatal mortality for absent diastolic flow is about 10%, whereas the perinatal mortality in case of reverse diastolic blood flow is about 33 to 35%. And this use of Doppler is mainly confined to the fetus with suspected intrauterine growth restriction. And it has been seen that if the fetus is in hypoxia, then there will be increased blood flow to the cerebral vessels, and this is known as brain sparing, which is seen during hypoxia, because the brain is a vital organ which needs more oxygen. So, there is increased blood flow to the cerebral vessels if the fetus is in hypoxia. That is why the ratio of middle cerebral artery systolic by diastolic to the umbilical artery systolic by diastolic, this refers or this indicates if there is any fetal compromise. And the Doppler changes occur in a pattern. Early changes occur in the peripheral vessels, the umbilical and the middle cerebral arteries, and the late changes include umbilical artery reverse flow, abnormal changes in the ductus venosus, and aortic and pulmonary outflow tracts. And the Doppler also is found to be identifying at-risk patients for future development of preeclampsia and fetal growth restriction by identifying a notch of the uterine artery, which is seen in uterine artery waveform in the second trimester. So, this is the use of Doppler. The antenatal testing recommendations So, the different tests are evaluated based on the clinical situation. A single test cannot be said to be the most significant or the most gold standard test. So, the antenatal testing usually starts around 32 to 34 weeks and it is repeated at weekly intervals. But in case of any complicated pregnancies, the test should be performed very frequently. So, this is the Doppler USG in antepartum fetal surveillance. The Doppler of umbilical artery is considered to be the most important one, which shows the blood flow to the fetus via the umbilical artery, of which the significant measurement is the systolic to diastolic blood flow ratio. It is considered to be abnormal if it is more than 95th percentile for the corresponding gestational age, or if there is an absent or reverse diastolic blood flow. And coming to the perinatal mortality, it is about 10% when the diastolic flow is absent, and if the diastolic flow is reversed, then the mortality increases to about 33 to 35%. And the use of Doppler is confined to fetus which are suspected to have intrauterine growth restriction. And in fetal hypoxia, there will be brain sparing because it is one of the vital organ which requires more oxygen. So, we take the ratio of middle cerebral artery systolic to diastolic blood flow to the umbilical artery systolic to diastolic blood flow to see if there is any fetal compromise. In case of fetal compromise, there will be increased middle cerebral artery flow and the decreased umbilical artery diastolic flow. So, now coming to the changes, early changes are seen in peripheral vessels and the late changes are seen in umbilical artery where there is reverse flow and there is abnormal flow in ductus venosus, aortic and pulmonary outflow tracts. So, the Doppler USG identifies the patients who are at risk for future development of preeclampsia and fetal growth restriction by identifying a notch in the uterine artery waveform in the second trimester. So, this is about the use of Doppler. Lastly, the antenatal testing recommendations. The antenatal testing should be started at around 32 to 34 weeks and it is repeated at weekly intervals for normal pregnancy, whereas for complicated pregnancy should be done more frequently. That's all for this video. Thank you.